Hey everyone, welcome back to the channel. If you're new here, I'm Desmond, and today we're going to talk about something really important when it comes to your health: metabolic acidosis. This might sound complicated, but don't worry. We'll break it down in a way that's easy to understand. By the end of this video, you'll know what it is, what causes it, and how it can affect your body. First things first, what exactly is metabolic acidosis? Well, this is a condition that occurs when your body's acid-base balance gets thrown off. More specifically, it happens when your body produces too much acid or when your kidneys can't remove enough acid from the body. This leads to a decrease in your blood's pH, making it more acidic than normal. Just like how we have to maintain a balanced diet, your body works hard to maintain a balanced pH level in your blood. A normal blood pH is around 735 to 745, which is slightly alkaline. But when it drops below this range, below 735, that's when things start to go wrong. So what causes metabolic acidosis? There are several conditions and factors that can lead to it. Let's go through some of the main causes. Diabetic ketoacidosis, DKA. This happens when your body breaks down fat for energy instead of sugar, producing too many ketones, which make the blood acidic. Check the video about DKA in my previous episode. Chronic kidney disease. If your kidneys aren't working well, they can't filter out enough acid from your blood. Lactic acidosis. This occurs when lactic acid builds up in the body, often caused by severe exercise, shock, or some medications. Renal tubular acidosis. This is a condition where the kidneys don't properly balance acid and base in your blood. Poisoning. Certain toxins, like methanol or antifreeze, can cause metabolic acidosis by introducing acids into your system. So as you can see, metabolic acidosis can be caused by a range of things, from diseases like diabetes and kidney failure to severe poisonings. How do you know if someone has metabolic acidosis? Well, there are a few key symptoms to look out for. Let's break them down. Rapid breathing, small respiration. This is your body's way of trying to get rid of excess acid by breathing more deeply and rapidly. Fatigue. Your body feels worn out because it's struggling to balance the pH in your blood. Confusion. Acid buildup can affect brain function, leading to confusion or even stupor. Nausea and vomiting. Your body reacts to the acid overload with gastrointestinal symptoms. Low blood pressure. This happens because your body isn't able to regulate blood flow and pressure properly when the blood becomes too acidic. If you notice any of these symptoms, especially in someone with a history of diabetes, kidney disease, or any of the conditions I mentioned earlier, it's important to seek medical attention right away. Now, let's talk about how metabolic acidosis actually affects the body. The main issue here is the buildup of acid in your blood. This can mess with several systems in your body, including your respiratory system, heart, and nervous system. Respiratory system. Your lungs try to compensate by increasing breathing to remove CO2, which is acidic. This is called small respiration. Cardiovascular system. When your blood becomes too acidic, your heart may struggle to pump blood effectively, leading to lower blood pressure and irregular heartbeats. Nervous system. The acid buildup can interfere with brain function, causing confusion, drowsiness, or even coma in severe cases. So, as you can see, the acid buildup affects multiple organs, which is why it's so important to treat metabolic acidosis as soon as possible. Let's make this interactive. Have you or someone you know been affected by metabolic acidosis? How did they manage it? Drop a comment below. I'd love to hear your experiences. So, how is metabolic acidosis treated? The treatment will depend on the underlying cause, but here's a general idea of what happens. Treating the underlying cause. If it's due to diabetic ketoacidosis, the person will need insulin to lower their blood sugar and stop ketone production. If it's kidney disease, they may need dialysis to filter the acids out of their blood. Administering bicarbonate. In severe cases, doctors may give sodium bicarbonate to help neutralize the acids in the blood. Fluids and electrolytes. Hydration and restoring proper electrolyte balance are key parts of the treatment. especially if the acidosis is due to dehydration or shock. The goal is to treat the underlying cause, restore the body's balance, and bring the pH of the blood back to normal. Preventing metabolic acidosis is all about managing underlying conditions and making sure you follow your doctor's advice for treatment. Here are some tips to help prevent it. Monitor blood sugar levels. Especially if you have diabetes, keeping your blood sugar in check can help prevent DKA, a common cause of metabolic acidosis. Take medications as prescribed. Follow your doctor's instructions for managing conditions like kidney disease or other chronic illnesses. Stay hydrated. Drink plenty of fluids, especially if you're sick or have conditions that cause fluid loss. Get regular checkups. Regular health screenings can catch problems early before they lead to metabolic acidosis. By staying on top of your health and working closely with your healthcare provider, you can help prevent this condition. So here are the key takeaways about metabolic acidosis. Metabolic acidosis happens when your body's blood becomes too acidic due to excess acid or inability to remove it. It can be caused by conditions like DKA, kidney disease, or lactic acidosis. Symptoms include rapid breathing, fatigue, confusion, and nausea. Treatment focuses on addressing the underlying cause, providing fluids, and sometimes using bicarbonate. Prevention is all about managing conditions like diabetes and kidney disease, staying hydrated, and getting regular checkups. Thanks so much for watching. I hope this video gave you a better understanding of metabolic acidosis and why it's important to manage your health conditions properly. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss a new video. And if you have any questions or comments, feel free to drop them below. Stay healthy, and I'll see you next time.